country is still recording more cases and deaths than any other place in the world. Doctors and nurses who have been battling the catastrophic surge say they're exhausted and burnt out.
There is so much to do that I do not have time to think about whether I'm exhausted at this point of time.
Dr. Jain runs a makeshift COVID-19 center in Delhi. When the 100 beds quickly filled up, he describes feeling helpless and stressed at having to turn patients away at the peak of Delhi's outbreak.
Usually you are working for approximately 14 to 15 hours in a day, and even if you are going back, then your phone is constantly ringing. So and even after that, you are still not able to help almost everybody. That is where the guilt comes to you.
ये 15-16 घंटे की शिफ्ट के बाद अगर कोई ऐसी चीज़ हो जिससे ये पता लग जाए कि एटलीस्ट हमारा स्ट्रेस लेवल कितना चल रहा है, we can at least think about it, and such a thing will really help a lot.
Mental health experts say that an entire generation of medical care workers will likely suffer prolonged psychological effects from working in this pandemic. Is there a way we could induce these heavily stressed folks to be a little more thoughtful about the lifestyle choices that they are making and their consequences? And also supplement with some easy ways in which they could inculcate good lifestyle habits into their work routine? Pragya is an inclusive mental health solution which is aimed at the frontline healthcare specialists and workers. With research, we developed a concept of a wearable assistant for supporting people during the working process and helping them spend energy rationally. The smart wearable is capable of monitoring body vitals necessary for predicting the emotional and mental state of the user. Wearable takes data from several sources. Then it transmits data to the application on a user's smartphone. Detects health parameters using some sophisticated techniques which can adapt to a certain user. Based on the history of health parameters, models get an appropriate recommendation for a particular user. Application is capable of providing custom suggestions for the user that can potentially combat stress and burnouts. The communities feature directly connect the user with his or her colleagues, motivating and not letting the user feel left out. The platform also brings together mental health experts to give free consultations to the users in need. During the project timeline, a prototype of the wearable was developed to test out the concept. This further helped in defining the scope of the solution and extend it to a larger base of users. The future roadmap of the project seems promising as the technology could be extended to every working professional, work environments, corporations and even in the rural India that lacks mental health care infrastructure. This was Team Pragya.